Benjamin Court is a ray of sunshine, physiotherapy and nursing care. You'll know by now, dear, how much we miss you. Please don't take Benjamin Court away. The ICB don't really know, dear. Our dream is what Norfolk needs. They closed it down and they were mistaken. They should hang down their heads with shame.
There's a message out that we're not going anywhere. We've been campaigning now for nearly 3 years. They thought they could get rid of us, but they're not getting rid of us. We're more right than we've ever been in our fight for Benjamin Court. We know that, and that's why we're here. So let's start by shouting, "Say Benjamin Court! Say 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 Benjamin Court!
Save Benjamin Court! Save Benjamin Court!
We need Benjamin Court, yes, you know it's true. Fit for me and you, physiotherapy, nursing, caring.
I'd like to ask Mary Littlefield, who's the Secretary of the Norfolk Unite Community, who just wants to bring some greetings and say a few words to you.
Hi, thank you very much. I'm really pleased to say we've brought our banner and we've brought some of our members with us from North Norfolk, and I'm from right at the bottom of Norfolk because it's a Norfolk-wide problem. Benjamin Court should be replicated, not got rid of. We should have Benjamin Courts in South Norfolk. In South Norfolk, for example, with the only walk-in centre we've got, unless you go to the N&N, to casualties, at Rouen Road, in the centre of the city. It's easier for people in where I live, on the border with Suffolk, to go to Rouen Road than it is to go to the N&N, and they're trying to close that. You know, I mean, it's the whole thing about not thinking about what communities need, how people are going to survive. I mean, I thought that letter that Martin read out just earlier on was absolutely telling. And that's the sort of thing that those people in there should be hearing, the real life experiences of people, because they are lying. Absolutely. When they say that they're going to improve the services, all the rest of it, that is shorthand for what? Cuts, 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 cuts.
Thank you. Right, we've got time, one more song and then a little bit more, and then we'll be going in. Okay, so another song if you're ready, maestros. Maestro.
They closed our hell, Benjamin Court.
Great popular campaign has been developed here around Benjamin Court. And as Martin said, we've been struggling about the closure of Lowestoft Hospital in 2013. It was then sold in 2018 and we're still struggling to get it reopened. It's an empty site, which is a massive great site, which could be developed in that way. James Paget has a regular 120 to 140 bed blocking every month. They just can't release it. We have Chris Brooks over there, he comes from Lowestoft as well, as part of the campaign to save Lowestoft Hospital and also to save Benjamin Court. So thank you very much. Thank you.
Hello everybody, just to say the LA 1880 branch of Unite fully supports what's going on here today and will continue to do so. What has been done by this Labour government is disgraceful. We have a unit that is fit for purpose. We should be using it. Bye for now. Thank you very much.
Thank you. Thank you.
Of the meeting today, but we've got one question which is directed particularly to the Norfolk and Waveney ICB, which we're going to take now, and this is a question from the Save Benjamin Court campaign. And Martin, I'm going to go to you to ask that question, so all yours.
Thank you, Chair. I'd like to also thank ICB, and please pass on the thanks to the staff at the ICB for accommodating us here today. I'd like, just before reading that out, just to say one thing that was sent to us this morning, just to give a context for what the question. This was from a member of the public who said, I live in Cromer, and last year I spent 8 weeks in hospital, 5 weeks in Norfolk and Norwich, and 3 weeks in Royal Papworth Hospital, including 2 heart procedures at Papworth. In early October 2025, I was discharged in a frail state, and so far I've received no hospital-based or community-based rehabilitation, apart from some helpful support from the community dietitian. Physio and OT support has been completely absent. 2 appointments made for assessments and both cancelled on the day they were due. I've now heard nothing for 5 weeks. This is care that would have been supplied at Benjamin Court, local and accessible. In the meantime, I'm getting weaker and less able to help myself. I despair. Well, I thought I'd just say that for context, so we understand the seriousness of what we're asking. I'll read the question out now. The post-hospital reablement service at Benjamin Court was closed in July 2023 with no consultation, and the site remains in great condition, albeit empty and mothballed, of delayed discharges of patients from hospital. In 1 month alone, September 2025, some £2.3 million was spent on keeping patients in hospital who were ready to be discharged at the 3 district general hospitals in the Norfolk and Waveney area. This, of course, has a knock-on effect on hospital admissions. In just 1 week, ending February the 15th, 2026, 83 ambulance shifts were lost at Norfolk and Norwich Accident and Emergency due to delays in transferring patients. In the 12 months from April 25 to March 26, delays at Norfolk and Norwich resulted in an extraordinary 2,328 lost ambulance shifts. Those are by far the worst figures in the whole area covered by the East of England Ambulance Service. The huge pressure on hospitals nationally as well as regionally has prompted the head of NHS providers to call for the government's much vaunted policy of neighbourhood healthcare to be turbocharged, a call we fully support. Yet Norfolk and Waveney Integrated Care Board, as we know shortly to be merged with a sister organisation in Suffolk, has up to now refused to look at an obvious solution right in their patch, Benjamin Court. We understand from our local MP that government ministers are taking an interest in health services in North Norfolk, which has the oldest demographic in the country, and particularly the future of Benjamin Court. So accordingly, we call on the ICB to follow the lead taken by University Hospitals of Leicester NHS Trust, who opened a 25-bed post-hospital rehabilitation unit to ease pressure on beds. We would ask that in any review of neighbourhood health services in North Norfolk, that you urgently look again at Benjamin Court and reopen it as an NHS hub to ease the crisis in hospital discharges and provide a vital health facility for the people of North Norfolk. We would also ask that you fully engage in a meaningful way with the local community about the way forward, and the Save Benjamin Court campaign stands ready to fully contribute to such discussions.
Martin, thank you very much, and that was very, very clearly put, and the sentiments behind what you said also came over very, very clearly. Thank you also for the context at the beginning, very helpful. Response from the ICB. Mark, can I come to you, please?
Absolutely, and thank you, Martin, and thank you all for coming today. I know I've met many of you before, and it is good to see you here. Long question, but trying to pick up some of the key points that you've mentioned. We are committed as an ICB to work with you, with partners across the system to improve health, well-being and care of the people in North Norfolk and across the whole of Norfolk and Waveney. And that we've always been that way, and we are absolutely committed to do that in the future. And I'd like to do that with you going forward as well. You made a point about the government direction, the focus on community neighbourhood. We warmly welcome that. I personally think that's absolutely the right direction of travel. With that particular focus on preventing frailty and supporting those who are frail, I think there's a lot more that we can do, and that's what I would like us to do working with you in the future. We're also very supportive of the ambition to shift care out of acute hospitals and into community to create a new neighbourhood service. I think that's very exciting. I think that's going to be presenting great opportunities for us all and for our population to provide better services and better outcomes. But we don't want to do that alone. We want to do that with you. We're also very conscious that Benjamin Court has provided very good services in the past, and we know it's really valued by residents. I'd suggest there's some excellent facilities right across Cromer and North Norfolk. And given the context of the new NHS 10-year plan, I think, since we last had detailed discussions on the subject, I think the world has moved on a little. So I would warmly welcome, Martin, I know we talked a little bit about this before, an opportunity to meet with you and spend more time looking at some options, because I think there are new options as the world has moved on since we last met. But once again, thank you. We are listening. We are listening as an ICB, and we do want to work with you.
Mark, thank you very much. Martin, would you like to respond to that?
Yes, I would like to respond, and I must admit, very pleased to hear from Mark what I'll say quite honestly is a very different tone from what we've had in the past, not from Mark personally, but from this body. And certainly we very much welcome the chance to be involved in discussions about Benjamin Court and the way forward in North Norfolk. What I would say, though, is that if the statement that I read out at the start means anything, it means that this is an urgent issue. We do not want to be wasting time. We don't want to be in the position of somewhere like Lowestoft Hospital still sitting there unused after all this time. We want to crack on with this. Benjamin Court is there. We've been told that it's in a good condition. It could be ready to be used really soon. So yes, please, we want engagement. We welcome that, and we really look forward to being able to get on with it soon. Thank you very much.
Martin, thank you very much. Mark, I think arising from Martin's question and follow-up, and indeed your initial response, can we take it as an action that you'll pick up with Martin and indeed the campaign team as soon as you can post-meeting?
Absolutely. We're very happy to do that. We'll email in the next couple of days. Thanks.
Okay, thank you very much. Thank you. Appreciate it. Did you want to come in again, Martin? Are you happy with that?
I think that's the way forward. I think we've all agreed that is a way forward. I mean, we're a long way to go, but we've got somewhere. And the main message is don't give up. We haven't given up, and we're not going to, I can assure you. Thank you.